Welcome to the class. So today we will start with management of bacterial vaginosis. Okay, so we have today's topic bacterial vaginosis, Trichomonas vaginalis, and recurrent candidial vaginitis. Okay, so these topics are important from clinical management point of view as well as microbiology point of view and pharmacology point of view. Okay, as usual, we'll start with our single based answer questions. You will have an idea what kind of questions are asked from this particular module. Okay, so we'll go one by one. So, Dr. Amrita, start.
Yes, sir.
Yes, sir.
Question one. Which
Question
of the
one. Which of the
following
following
characteristics best
characteristics
describes
best describes
Trichomonas
Trichomonas
vaginalis?
vaginalis?
Option A,
Yes. Option A,
gram-positive
gram-positive. Yes.
B,
B,
flagellated
flagellated
protozoan without the
protozoan
cyst
without a
form.
cyst form.
O-
O-
Option C,
Option
commensal
C, commensal
organism of the
organism of the
vaginal flora.
vaginal flora.
Option D,
Option D,
encapsulated yeast with
encapsulated yeast with
pseudohyphae.
pseudohyphae.
Option E,
Option E,
spore-forming
spore forming
anaerobic
anaerobic
bacillus.
bacillus.
Sir, option
Sir,
B.
option B. Okay.
B.
Option B.
Option B. Next question.
Uh,
Uh,
Question 2. Which of
Question
the
2. Which of
following
the
is
following
preferred
is preferred
first line
first
treatment for
line treatment for
bacterial
bacterial
vaginosis?
vaginosis?
Option A,
Option A,
fluconazole.
fluconazole.
Option B,
Option B,
metronidazole.
metronidazole.
Option C,
Option C,
azithromycin.
azithromycin.
Option D,
Option D,
amphotericin B.
amphotericin D.
Option E,
Option E,
ceftriaxone.
ceftriaxone.
Sir,
Yes. Sir,
option
option
So it's B,
B.
metronidazole. B,
metronidazole.
metronidazole.
Metronidazole. Okay. So the question one answer is B, that is flagellated protozoa without a cyst form. Okay. So Trichomonas vaginalis is a motile flagellated protozoa that exists only in trophozoite form and does not have a cyst form. Okay. Now question two answer is metronidazole. Bacterial vaginosis is commonly caused by Gardnerella vaginalis and overgrowth of anaerobic bacteria. Metronidazole, an effective antiprotozoal and anaerobic antibacterial agent, is the first line treatment. Okay. So next question, Dr. Priyanka, you will take question number 3 and question number 4.
Yes, sir. A
A
30-year-old woman
30-year-old woman
presents with
presents with
intense vulval
intense
itching,
vulval itching,
thick white
thick white
vaginal discharge,
vaginal
and
discharge, and
erythematous vaginal
erythematous
mucosa.
vaginal mucosa.
Wet mouth
Wet mouth
microscopy reveals
microscopy
budding
reveals
yeast and
budding yeast and
pseudohyphae. Which
pseudohyphae.
of the
Which
following
of
is the
the
most
following is the
likely
most
positive
likely positive
organism?
organism?
Options are
Options are
Gardnerella
Gardnerella
vaginalis, Candida
Candida
albicans,
albicans,
Trichomonas
Trichomonas
vaginalis,
vaginalis,
Neisseria
Neisseria
gonorrhea,
gonorrhea,
and Chlamydia
and Chlamydia
trachomatis.
trachomatis.
So answer is
So
Candida
answer is
albicans.
Candida albicans. Correct. Here you remember the yeast and pseudo hyphae. So these are the what you can say the buzzwords, and these are the words which will point towards the answer. So whenever any question you will get in the final examination, please read the question very carefully and search these kind of words. Okay, you will get the answer from those particular words. Okay, then you just have to select the answer out of the 5 options. Next, you go ahead, Dr. Priyanka.
Which of the
Which
following
of the
diagnostic
following
methods
diagnostic
is the
method
most
is the most
sensitive for
sensitive
detecting
for detecting
Trichomonas vaginalis
Trichomonas
infection?
vaginalis infection?
Options are wet mouth
Options are wet mouth
microscopy,
microscopy,
gram stain,
gram stain,
NAT,
NAT,
culture in diamonds
culture in
medium,
diamonds
and
medium,
pH
and
measurement
pH
of vaginal
measurement of
discharge.
vaginal discharge.
The answer is
The
wet
answer
mouth
is wet mouth
microscopy.
microscopy. See, they have asked most
Most
sensitive.
sensitive,
Most
then it will be
sensitive,
NAT,
then it will
sir.
be nat. Correct, correct. So, when you read the question, you have to specify like most commonly used may be different and most sensitive may be different. Okay.
Yes, sir.
Are you getting it? So what exactly they have asked is the most sensitive. So the
Most
NAT should be
sensitive,
the
so NAT.
answer. Okay.
Yeah.
So question number 3 is a Candida albicans. Vulvovaginal candidiasis is the most commonly caused by Candida albicans. A yeast-like forms pseudohyphae. It presents with thick white cottage cheese-like discharge, pruritus, and vaginal erythema. Okay. And question 4 answer is a nucleic acid amplification test, and that is highly sensitive for Trichomonas vaginalis. Okay, it is specific diagnostic test for TB, Trichomonas vaginalis, outperforming wet mount microscopy and culture. So basically, you have wet microscopy, you have culture, and you have NAT, but the sensitivity will be more with the NAT. Dr. Priyanka, can you, sorry, Dr. Sinchana, can you take these two questions?
Yes, sir.
Yes, sir.
27-year-old
27-year-old
woman is
woman
diagnosed
is
with
diagnosed with
Trichomonas Vaginalis.
Trichomonas Vaginalis.
Which of the following
Which
is the
of the
drug of
following is the
choice for
drug
the
of choice
treatment?
for the treatment?
A.
A.
Fluconazole, B.
Fluconazole, B.
Clindamycin,
Clindamycin,
C.
C.
Azithromycin, D.
Azithromycin, D.
Metronidazole,
Metronidazole,
Doxycycline,
doxycycline,
D. Metronidazole.
D. Metronidazole. Correct. Next question.
A patient presents
A
with a
patient
fishy
presents with a
smelling
fishy
grayish
smelling
vaginal
grayish
discharge.
vaginal discharge.
Wet mount
Wet
microscopy
mount
reveals clue
microscopy
cells.
reveals
What
clue
is
cells.
most
What
likely
is most
diagnosis?
likely diagnosis?
A.
A.
Trichomonas
Trichomonas
vaginalis,
vaginalis,
B.
B.
Vulvovaginal
Vulvovaginal
Candidiasis,
Candidiasis,
C. Bacterial
C. Bacterial
Vaginosis,
Vaginosis,
D. Chlamydial
D. Chlamydial
cervicitis,
cervicitis,
E. Pelvic
E.
inflammatory
Pelvic
disease,
inflammatory disease,
C. Bacterial
C. Bacterial
vaginosis.
vaginosis. Yes, clue cells is a buzzword. Okay, so here bacterial vaginosis. So question number 5 is metronidazole, the drug of choice for treatment of Trichomonas vaginalis. So question 5, metronidazole is the answer. Or trinidazole can also be used. Is the first line treatment for Trichomonas vaginalis. Fluconazole is used for Candida, while azithromycin and doxycycline are used for bacterial STIs. Okay. And question number 6 is a bacterial vaginosis is characterized by thin grayish white discharge with a fishy odor. The presence of clue cells on microscopy is diagnostic. Okay. Dr. Sansi had joined or no? If
Yes,
Dr.
sir.
Sansi is, you are there? Yes, yeah. You
Yes,
go
sir.
ahead with next two questions.
Which of the
Which
following
of
is
the
the
following is the
hello?
hello? Hi, yeah. Go ahead. Go ahead.
Which of the
Which
following
of the
is the
following is the
preferred treatment for
preferred treatment for
uncomplicated
uncomplicated
vulvovaginal
vulvovaginal
candida
candida
candidiasis?
candidiasis?
Oral
Oral
metronidazole.
metronidazole.
Sir, I think it's
Sir, I think it's
the voice
the
from my side
voice from my side
is
oh,
not
okay.
clear.
Not clear. Yeah, yeah, but I can hear you. You can answer.
Okay, okay,
Okay,
sir.
okay, sir.
Oral
Oral
metronidazole,
metronidazole,
intravaginal
intravaginal
clindamycin,
clindamycin,
oral
oral
fluconazole,
fluconazole,
intramuscular
intramuscular
cefpriox,
cefpriox,
topical
topical
acyclovir,
acyclovir,
oral
oral
fluconazole, sir.
fluconazole, sir. Okay. Next
A,
question.
a
A 35
35-year-old
year
woman
old
presents
woman
with
presents with
frothy
frothy
yellow-green
yellow
vaginal
green
discharge
vaginal
and
discharge and
intense
intense
vaginal
vaginal
itching.
itching.
Examination reveals a
Examination reveals
strawberry
a
cervix.
strawberry
What is
cervix.
the
What
most
is the
likely
most likely
causative
causative
organism?
organism?
Gardnerella
Gardnerella
vaginalis,
vaginalis,
Candida
Candida
albicans,
albicans,
Trichomonas
Trichomonas
vaginalis,
vaginalis,
Neisseria
Neisseria
gonorrhea,
gonorrhea,
Chlamydia
Chlamydia
trachomatis.
trachomatis.
Sir C.
C.
Trichomonas
Trichomonas
vaginalis.
vaginalis. Correct. Strawberry cervix is the here characteristic word which you should remember, and strawberry cervix is seen in Trichomonas vaginalis. However, this particular kind of cervix is seen in hardly in 2% of cases. Okay, it's not that very common, but you should remember this particular word with Trichomonas vaginalis. Okay, so question number 7 is oral fluconazole. A single 150 milligram dose of oral fluconazole is the preferred treatment for uncomplicated vulvovaginal candidiasis. Intravaginal antifungal agents like clotrimazole or miconazole are also effective. Question number 8, answer is Trichomonas vaginalis causes frothy yellow-green discharge and is associated with strawberry cervix due to inflammation. It differs from bacterial vaginosis and candidiasis. Okay, so Dr. Amrita, next two questions.
Yes, sir.
Yes, sir.
Question 9.
Question
Which
9.
of the
Which of
following
the
best
following
describes
best
the
describes the
pathogenesis of
pathogenesis of
bacterial
bacterial
vaginosis?
vaginosis?
Option A,
Option A,
overgrowth of
overgrowth of
lactobacillus
lactobacillus
species.
species.
Option B,
Option
infection
B,
with Candida
infection with Candida
albicans.
albicans.
Option C,
Option
loss of
C, loss
normal
of normal
lactobacilli and
lactobacilli
overgrowth
and
of
overgrowth of
anaerobic bacteria.
anaerobic bacteria.
Option D, persistent
Option D,
infection
persistent
with
infection with
Trichomonas vaginalis.
Trichomonas vaginalis.
Option E, autoimmune
Option E,
inflammation of
autoimmune
vaginal
inflammation of
mucosa.
vaginal mucosa.
Sir, option
Her option
C.
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 Option
Answer
C.
C.
Answer C.
Loss of normal
Loss of normal
lactobacillus and
Option
lactobacilli
C.
overgrowth.
and
Yes.
overgrowth of anaerobic bacteria. Okay. Next question,
C.
Dr. Amrita, you
Question
go ahead.
number
Question
10.
number 10.
A
A
32-year-old woman
32-year-old woman
presents with
presents with
yellow-green frothy
yellow-green
vaginal
frothy
discharge
vaginal
and
discharge
intense
and
vaginal
intense
itching.
vaginal
On
itching. On
examination, you note
examination, you note
erythema of the
erythema of the
vaginal walls
vaginal walls
and a strawberry
and a strawberry
cervix.
cervix.
A wet
A
mount of
wet
the
mount of
vaginal
the
discharge
vaginal
reveals
discharge reveals
motile,
motile,
flagellated
flagellated
protozoa.
protozoa.
Which of the
Which
following
of
is
the
the
following
most
is the most
appropriate treatment?
appropriate treatment?
Uh, Sir,
The
option
Sir,
C.
question,
option C.
yeah,
Option
it
A,
is
Option
repeated
both.
A,
question.
both.
Yeah, option
Only
C.
they have for reframe the question. However, the question is repeated. Okay. So the oral metronidazole is the treatment of choice. And remember, for Trichomonas vaginalis, it is this oral treatment is effective, not the local treatment. So question number 9: loss of normal lactobacilli and overgrowth of anaerobic bacteria. So bacterial vaginosis occurs due to the decrease in lactobacilli, leading to overgrowth of anaerobic bacteria such as Gardnerella vaginalis, Mobiliancus, and Prevotella. Okay. Question number 10 answer is metronidazole. Trichomonas vaginalis is treated with oral metronidazole, 2 grams single dose or 500 milligram BD for 7 days. And intravaginal treatment is ineffective. Okay, even if the patient has got intense itching, the treatment is oral. Okay, here in this TV. Trichomonas vaginalis, fluconazole for candida, and ceftriaxone is for gonorrhea. So these are the drug of choice. Remember, the drug of choice for all infections you need to know the drug, doses, duration, and associated, whether we have to do the test of Kiver, we have to treat the partners, sexual partners for how many days, the contact tracing, everything you should know. And sometimes they will give you the answer little confused. All answers will be similar, but in some there will be test of cure will be included. Screening partner is to be treated, so that becomes more and more specific. Are you getting it? So read the all options very carefully. So we'll go ahead with next, Dr. Priyanka. Next two questions.
A
A
28-year-old pregnant
28-year-old
woman at
pregnant woman
18 weeks
at 18 weeks
gestation
gestation
presents with thin
presents with
gray
thin
vaginal
gray
discharge
vaginal
and a
discharge
fishy
and a
odor.
fishy odor.
Microscopy shows flu
Microscopy
cells
shows
and
flu cells
vaginal
and
pH is
vaginal
greater than
pH is greater than
4.5.
4.5.
Which of the following
Which
is
of
the
the following
safest
is the
treatment
safest
option in
treatment option in
pregnancy?
pregnancy?
Oral
Oral
metronidazole,
metronidazole,
intravaginal
intravaginal
clindamycin,
clindamycin,
oral
oral
fluconazole,
fluconazole,
doxycycline and
doxycycline and
azithromycin.
azithromycin.
So we will go with
So we will
oral
go with oral
metronidazole.
metronidazole.
So they are asking 28-year-old pregnant woman, and she is in the second trimester, and we have been asked the safe drug. Okay, so then we should know about the safety of the drug also. Most of the time they will ask some questions which are related to the pregnant woman and some pharmacology. Okay, so we have to be very
Yes.
specific about the teratogenicity. So what about oral metronidazole? Can we give?
Yes, so we can
Yes,
give
sir,
Yes,
it.
we
sir.
can.
Yeah,
Yes, sir.
yes. Go
Second
ahead with the
trimester we
Second
next.
can give
trimester
it.
we can give it.
Next question.
A 29-year-old woman
Dr.
presents with
Priyanka, go ahead
recurrent
with
With
the.
episodes
recurrent episode
Yes,
of
yes.
vulval
of
itching,
vulval
thick
itching, thick
white vaginal
white
discharge,
vaginal
and
discharge,
vaginal
and
soreness.
vaginal soreness.
He reports
He
four
reports
similar
4
episodes
similar
in the past
episodes in the
year.
past year.
The
A
microscopy shows
microscopy
budding
shows
leaks and
budding leaks and
pseudohyphus.
pseudohyphus.
Which of the
Which
following
of
is
the
the
following
most
is the most
appropriate next step
appropriate
in
next step in
management?
management?
Options are single
Options are
dose
single dose
fluconazole,
fluconazole,
weekly
weekly
fluconazole for 6
fluconazole for
months,
6 months,
metronidazole 500
metronidazole
mg
500
BD for
mg
7
BD for
days,
7 days,
doxycycline 100
doxycycline
mg
100
BD for
mg
7
BD for
days,
7 days,
and last option
and
is
last option is
clindamycin
clindamycin
vaginal cream for
vaginal
7
cream
days.
for 7 days.
So I would go
So
with
I would
single
go
dose
with single dose
fluconazole.
fluconazole.
She
Weekly
reports
Weekly
four.
fluconazole.
fluconazole.
Weekly
She
Weekly
reports.
fluconazole for 6
fluconazole for
months
Yeah.
6
because
months because
She
recurrent
reports four
episodes.
similar. Yeah. She reports four similar episodes in the past year. This is very important line. So reading the question carefully is important, no doubt. Fluconazole per se is an acute vulvovaginal single episode. This particular is a drug of choice. But when we have a recurrent episode, in that particular case, we will go ahead with the weekly fluconazole. So question number 11: oral metronidazole. Metronidazole is safe in pregnancy and is preferred treatment for bacterial vaginosis. Doxycycline is contraindicated in pregnancy, and fluconazole is used for fungal infection, not for bacterial vaginosis. Okay. Then next is a fluconazole for 6 months. Weekly fluconazole. Recurrent vulvovaginal candidiasis more than or equal to 4 episodes per year requires long-term suppression therapy with weekly fluconazole for 6 months, a single dose is not sufficient. Okay, so recurrent candida vaginalis we will see today in the lecture. All treatment will go into the detail, the safety of the drug, etc. Everything we will see. Next, Dr. Sinchana, this single one question.
35-year-old woman
35-year-old woman
presents with vaginal
presents with
itching and
vaginal
abnormal
itching and
discharge.
abnormal discharge.
Our symptoms
Our
started three
symptoms
days
started
ago.
3 days ago.
Examination reveals
Examination reveals
erythematous vaginal
erythematous
mucosa.
vaginal mucosa.
Our vaginal
Our
discharge
vaginal
characteristic
discharge
are as
characteristic
follows:
are as follows.
pH 4,
pH 4.
microscopy shows budding
Microscopy
yeast
shows
and
budding yeast and
pseudohyphae,
pseudohyphae.
odor absent.
Odor absent.
Which of the following is
Which of
most
the
likely
following is most
diagnosis?
likely
A.
diagnosis?
Bacterial
A.
vaginosis.
Bacterial
B.
vaginosis. B.
Trichomoniasis. C.
Trichomoniasis. C.
Vulvovaginal
Vulvovaginal
candidiasis.
candidiasis.
D. Gonorrhea.
D.
E.
Gonorrhea.
Chlamydia.
E. Chlamydia.
C.
C.
Vulvovaginal
Vulvovaginal
candidiasis.
candidiasis.
Correct. Here pH as well as budding yeast and pseudo hyphae. Okay. So these are the two important things. So acidic pH. So vulvovaginal candidiasis, a candida infection present with itching, thick white discharge, normal vaginal pH less than 4.5, and absence of odor. Bacterial vaginosis and trichomoniasis have elevated pH and are associated with foul smelling discharge. Okay. Next, Dr. Amrita, these two questions for you.
Yes, sir.
Yes, sir.
Question 14.
Question
A
14. A
30-year-old woman
30-year-old woman
is diagnosed
is
with
diagnosed with
Trichomonas
Trichomonas
Vaginalis
Vaginalis
infection. She
infection.
is
She
treated
is
with a
treated
single
with a
dose of
single
oral
dose of oral
metronidazole.
metronidazole.
What is the most
What is the most
appropriate
appropriate
management for her
management for
male
her
sexual
male
partner?
sexual partner? Uh,
Option A, no
Option A,
treatment,
no treatment.
Dr. Amrita, you are not audible.
option D,
Option D,
Huh? Yeah,
week,
go ahead. Yes.
single dose
single
oral
dose oral
fluconazole.
fluconazole.
Option E,
Option E,
weekly
weekly
metronidazole for
metronidazole
6
for
months.
6 months.
Sir,
Third
option
option
C,
C only.
I think,
B. Treat if
B, treat
symptomatic.
symptomatic.
sir, option
Sir,
C.
option C.
Okay, go ahead with the next question.
Yes, sir.
Yes,
Question
sir.
15.
Question 15.
A
A
42-year-old woman
42-year-old
with
woman
poorly
with
controlled
poorly
diabetes
controlled
mellitus
diabetes mellitus
presents with severe
presents with
vulval
severe
itching
vulval itching
and thick white
and thick
vaginal
white
discharge.
vaginal discharge.
Microscopy shows
Microscopy shows
pseudohyphae.
pseudohyphae.
She has had
He has
multiple
had
episodes
multiple
despite
episodes
treatment
despite
with
treatment with
fluconazole.
fluconazole.
Which of the
Which
following
of the
is the next
following is
best
the
step?
next best step?
Option A,
Option
increase
A, increase
fluconazole dose.
fluconazole dose.
Option B, treat
Option B,
with
treat with
topical
topical
metronidazole.
metronidazole.
Option C, perform
Option C,
culture to
perform
check
culture
for
to check
Candida
for Candida
glabrata.
glabrata.
Option D, start
Option D,
oral
start oral
doxycycline.
doxycycline.
Option E,
Option
administer
E,
a single
administer
dose
a
of
single dose of
ceftriaxone.
ceftriaxone.
Sir, option
Sir,
C.
option C.
C.
Yes. So you in such cases when you are giving proper treatment and the patient is not responding, you should take the culture and check whether any other species which is resistant to the particular drug which you are using. You have to check. Okay. So Candida glabrata is most of the time resistant to the fluconazole. However, here if you have an another option to control her sugar, okay, that can also be another alternative. Okay, so remember that particular thing. Next, doctor, so we'll just see the answers. So question number 14 is a single dose oral metronidazole. The sexual partners of individuals with Trichomonas vaginalis must be treated simultaneously with oral metronidazole regardless of symptoms to prevent reinfection. Okay, and this we have discussed. Perform culture to check Candida glabrata. So explanation is recurrent or fluconazole resistant infections in diabetic or immunocompromised patients may be due to Candida glabrata, which requires different antifungal treatment, either topical boric acid or amphotericin B, vaginal suppositories, etc. Next, Dr. Priyanka, take this single question.
A
A
24-year-old woman is
24-year-old woman is
diagnosed with
diagnosed with
Trichomonas
Trichomonas
vaginalis
Vaginalis
infection. She
infection.
is at
There is
increased
an
risk of
increased risk of
co-infection with which of
co-infection
the
with which
following?
of the following?
Candida
Candida
albicans,
albicans,
Gardnerella
Gardnerella
vaginalis,
vaginalis,
Neisseria gonorrhea,
Neisseria gonorrhea,
Escherichia coli,
Escherichia
and
coli, and
Mycoplasma hominis.
Mycoplasma hominis.
The answer is
The answer
Gardnerella
is Gardnerella
vaginalis.
vaginalis.
Gonorrhea.
So,
C.
Gonorrhea,
Gonorrhea.
C. Gonorrhea.
it is a C.
Gonorrhea.
Neisseria gonorrhea. Trichomoniasis is sexually transmitted infection and is often associated with other STIs such as gonorrhea and chlamydia. Okay, so
Yes, sir.
because these STIs are go together. Okay, Trichomonas vaginalis will be associated with gonorrhea and chlamydia.